Hey, good evening, Palau-wide. Good evening, worldwide. Good evening to everybody. This is Alfonso Diaz. We're going to do this update tonight, which is we all know that it's scheduled for Thursday evening, but the urgency of this information has to go out to the people. So what we have here tonight is Commander Bostrom. Commander Bostrom from CDC, and also our Commander Udui is also with us, and all the EOC members. Good evening, everybody, and welcome to this update from EOC. Madalwese solange kadmamu leriter, mang sakli di reklo aisilwase ngarel belawa obonged. I hope that obonged rabi chin sabi ki ngariat updates. Malungil ko sengel moraru ko other reklo audience ra. IP FM solay bots veden mot maga the broadcaster tel updates and moraro kuil other tira o kuknatun ini o reng sra update tra EOC elo ya WWFM madirekl Eco Paradise. Okay, madalo se sola marungil ko sengay yedung walan ngumsa Commander Udui mabolo mo ra programa gidral ko sengay Commander Udui.
Oh ya, sulang tulig yung ngil ko sengay.
Ko sengay.
Oy. So kato ko rati ko overay gele update rigi del akum das war adal ako ramal di sorry mom dingya number ay gal case.
I say.
Maximo o ay say gele le update tra kasus and then edi may skip rigi del wal kora. Kaya ko rati ka kalbol final lour.
Okay.
Mang di kora tentative ura el altil sa mamatir ka malaya yero kuil lo urmesel pol later el algabsengay ang sa amlo sa di segi del mal al hora updated al shasting al diesel ay gidele case so segi dia ya kada dengel wasa eli ang malgoram lo obuto ka guys segi del lo 55
okay
ngaringia 255 al test ra contact tracing al dri rule etiay dan longara 48 positive ni ngaringi sirgelem le outbound el duru le dirakal 92 ya a fiber tiram lo positive mang del total el total case ra a eli no dirakal naringan nila IR lo 55 masay el lo oral 55 eli ngarinya kadamlo ulara rogu yang ni rogu el total cases amlo 119 lengar nga igele active cases travel el 92 ay gele ora din lakal sa amal giti telwase ay gang connected al morangaral travel case ay kira ko amle 8 etirgel mlamongil el up to elia a 19 matawal tilo para isolation. So sa ng 119 na cumulative cases since rato ato hotel mo start lo mesa cases sira August 20 last year el mer el ang.
I see.
Tirigal abel nga quarantine up to LL till samle 394. LR other surveillance ra malamol mal el marula contact tracing mildang al mer eli. And then mo sa amal update ra number sa maltelang al adal nga quarantine kada tingel wasesel lorula contact investigation ito mo tomodong ring gelgay se wasay kawam larigera o ingaral time truas ala kapas ka mang clear adal problem ke the still el momiter sayid el definition el dol gornil wasay tru may malbungol al kaybuge del ngara karera 6 feet dalong lila lidel til ab elang sayidra hakasusal leitra kasusal mer elal tutawe ay gel goram la sabamlo doktal lo ureng ngaradoria okay so maselway sayideng walbol el 100 toria active hindi mla ka complete ra isolation or team malubak dong tilwa sa recover tamong biro ko sisiwa ha o urigit ngariar mo test ra klugo ra o truel mina sen moment testit maltak lugo ng buk mo ngariar mla mo ngil the release ter sir min sa buk mo o telgibel ngarba ba o urigit.
I see.
Oy. So sige da tulig ngarnya direkal sele kora PSA diri multabdil wasay ngomur al sils ang modia ka oting lara hospital. Kapag ulasem lari sel 1 hour 6 to 7 na. Dar adal mer hospital me mesra har adri smeran di elangi because to take the situation negida sengora batakna geise en so adal gora protected tiral smeran adal ngara hospital magpatya ka oding modia ka adal mesois pro hospital dia ka do tingel sa kadam tingel wasit sa doktor tiral smera asymptomatic or tiral smera covid asymptomatic hindi also adal gora sa sige del tial musabel me eso isabel mo ulang mo niya klol pre la rakter al sila al water hospital.
So in other words, no visiting authorized.
Why say?
As of today, no visiting to hospital. So all of those people planning to go to visit relatives at the hospital, that has been stopped, right?
Why say? So no visiting hours. Hindi gimadangel wasay adadal mera dire close pe a supply sa klalo lola para adara baluwal may agi say given temel oding lag 6 elol maklon mo with the clorac say so 6 p.m. to 7 p.m. every evening ngaringar adal mo station de tel madala hospital tel elabi elmo omlay ay gahidel udurok len mo so isbra al sel hospital. So please, when you come, make sure it was labeled. Look lang klela arum number award the hospital, and then say that mangudula esel bole with the clomal masimbre, and then it's a mile mong deliver sila other rare mo deliver al sila da. Mo subeseng mal di mal makasayar other rare man.
Okay.
Kaya sabihin mo mga la time the say gida ko sabihin al time the set aside ringil mo o malaygay gidal klalo mo lablo mastria atadangal sil hospital.
I got a question. Is it possible that you change your policy to require everyone that step out of the door or of your house you must wear a mask? I think if we mask everyone, that also will minimize the spread of these COVID-19. Is it possible that you change your policy to make us required to wear masks when we go outside or go to a restaurant or go to a store? Any public places you go, you must wear a mask. Can you change your policy to reflect that?
Kung sa tulig ang nanasuwag sa MHHS directive, alwasang require masking ra everywhere, every public area over niya, ang ginil nga mask. Even pag kumangkurangan nga on developly mara outside labim kung sumong 20 or more engiri low mask dire.
I see.
So platform the say del pesel directive ra susel wasay na mo require mask mong other ko la mo giri low mask physical distancing.
I see. Hindi kaya gida madagay government adi malmol sponsor ay gagi del program mal open function selngia ngo kitriar tokla del moklidibra imol basyo waya tele 680 night market direct ngaria ado do meset tira totra otrulin dia halo mask mong direct dia hal help mong government aba should do something not to sponsor ay gagi del activities and more require rara mo kayo ge de kayo ta Momok da stove sola telgibel smisi al-ud mergomor tirak lagi gidel ud mabong al-ud tagi del rak te sola kumdas ang la direct maran berio aradal mo positive lang arada pati ka careless
why saying mal why say tuli mal gira del al make sure ang kadol tirak lagi gidel la gidel bladero mga akunda sa minister ang mamartial president leadership meeting at afternoon ang dilulwa sa kaya awngil mo mong last para way sige de londi bla kora ngaringil batokal adlen kira na mo gira del malas el mla omu ala sige ng self directive sa wal effective ra kasus ang gira del mga sa del maluba ka toro bay gay gidel kora batokal al maklol mask gathering الكلوتي على البورات تويو لا سلطة سميل ولا رفض المراسرة.
Why say all we ask the public, all we ask is practice what you preach. You don't come out to the public and say you're required to wear mask, and yet high officials of this government are out there on the inauguration of Peliliu, Ngarard, and elsewhere, Koror, without mask, and we see them on television. So, as public, we do this, what they call a mangi see, mangi do. We see you doing it, so we said maybe they're not serious. So let's all be serious and do these things right in order to minimize the spread of COVID-19. Remind each other, high officials wear a mask, so do the same. Ata. Don't mami.
Yes, exactly. So, ay kay ako ra abesel update etulig ang bay sabedel ngwa igal ngul masa ang karupa balkora mo nga sual mungi nga karimel moringi sem loger and then open el mora.
Okay, so it's okay now. I know there's some people that told me this afternoon they would like to call in and ask questions directly to either Commander Hancock or Commander Prostrom.
Yes.
So if he doesn't mind for us to answer some of the questions, can we do that?
Yes,
okay.
Thank you, sir. Yes, no problem. This is Commander Prostrom here.
Okay. Good evening, sir.
Good evening.
And welcome.
Yeah, so maybe if there's anything specific you want to address, go ahead, and then we'll take calls.
Okay.
Sure. Thank you. First of all, Commander Richard Prostrom from CDC, here with Commander Thane Hancock, and actually two other Public Health Service co-commanders, Kazu Okamura and Nick Munoz, and the four of us, the same team that responded to the outbreak when it first occurred in Saipan.
Okay.
And then we arrived here on Thursday night, Friday morning, to respond, to assist, work side by side with the EOC here and with the team to get ready for Omicron.
Okay.
We've hit the ground running and wasted no time, and have had several meetings with, of course, the EOC and the team here, the minister, as well as with the president and cabinet members today with the leaders. Very impressive and imposing group, just to help to share where the outbreak is at this point and where it might go. What is the level of readiness for Palau, for Palau's community in particular, the hospital, as well as public health, and it's very clear, of course, that Palau is ready.
Okay, Commander Prostrom, I got a caller. Can you take the call?
Sure.
Okay. Welcome to caller. Kabong.
Yes, good evening, Commander. My question is, I've been following the statistics of Palau's COVID, and I have just like a question about the probable case. How can a person become a probable case, and is that a positive or a negative, and what makes it a probable case?
Okay. Did you get that question?
I did, I'm going to ask Ritter to see if she take this one, because probable cases are defined differently in different jurisdictions. And in the beginning of a pandemic, we separate out those that are probable over those that are confirmed. Usually by the middle of an outbreak, we call most cases confirmed in real cases. But go ahead, explain the difference for your reporting.
So for the purposes of this recent probable case, we got an antigen for the first time that we tested. There was it came out antigen positive. We put it through PCR, a gene expert. the first run was a negative. We got another swab, we put it in. The CT values came out, the E gene was 0. The CT value for the N gene was 43.3. After consultation with Commander Hancock, we decided to rule it a probable case and then isolate that individual for 3 days, retest on day 3. When we tested on day 3, the antigen test was negative. The PCR test was negative. So we ran the test again the next day, and we also got the same results, another antigen negative and another PCR negative, gene expert. So we ruled it a negative and then false positive case, and that's how we resolved the problem case.
Unconfirmed. It was unconfirmed case.
Okay.
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 It makes sense.
Makes sense, right?
Palau has done very well to get several different testing capacities here. There's 3 or 4 ways to diagnose COVID-19 in Palau, and the first test was positive on this one, but the second test, which takes longer to run, it sounds like it was negative. So then you have to manage these patients when the tests don't agree. Most of the time, they agree.
Okay. So, caller, you satisfied with that answer?
Yes, very understandable now.
Okay.
Thank you.
All right, thank you. Bye-bye. Okay, let's continue on.
So you can continue. You need any,
Oh, okay. Well, in talking with in the EOC here, there's some really key messages that we want to share for the community. Some of these are messages you've been hearing for a year now, but now that the pandemic is here, they're really important. The no hospital visiting is a new policy that was added along with public masking. It is important to avoid, try to avoid big crowds, especially if not masked, especially if indoors. Better to be outdoors and with a small group and a mask on. You're pretty safe that way, outdoors with the mask, with 3 feet of distance. So that works pretty well. And then it's important to not to go to work if you're sick, or not to send your child to school at this point. I know school's canceled, but really important if you have a scratchy throat, or your nose is running, or you have a mild cough, or even if it's a little bit of fever, it's best to stay home, of course. You may not even need a test. It's pretty sure it's probably Omicron, and it's probably COVID. Not everyone has to have a positive test, but it is important that you stay home for at least 5 days until you feel better. At least a whole day after you've had a fever, and not to enter the workspace or be in a public area where you might be able to spread it.
I see.
Finally, I think it's really important that it's not too late to get your booster. So what has happened is Palau is so good with their vaccines that many people were vaccinated in March or April.
Right.
But unfortunately, the immunity has slowly gone down in this time. We knew that was a possibility, and sure enough, a little bit less protected as time goes on. And then the Omicron is also affects your vaccine's effectiveness. So if you have a booster, you're in good shape, right?
Okay.
So that even though the Palau has some of the best rates of vaccination in the world, the booster rate still needs to be higher for Omicron. So
okay, Dr. Brostrom, here's the question. I'm a little confused when you say go and get your booster. Now the question is, can you bypass the Moderna and Pfizer and just go directly to get your booster, or you have to have 2 shots of Moderna and 2 shots of the Pfizer in order to get your booster? Is that what you are trying to say?
Yes, that's great, and I apologize if that wasn't clear. If you're not vaccinated, go get vaccinated. If you're already vaccinated, you still need that third shot, that booster.
Okay,
But
clear.
it's not too late to get your first or second shot. If you've been waiting for some reason to get your vaccine, boy, don't wait another minute. And Ritter, when is the next booster and adult vaccine clinic going to be?
So sa el tema la booster vaccination na klubok, al Tuesday ra 3 o'clock al mo 6 o'clock ra Palau National Gym.
Okay, may dito ay silwasay direct marara ay garro good radio station ma television lo ay silwasay ang oingram oingral sil serker o borgira telaklor ma telaklor svemen mga booster gaw maluben third shot gaw era gymnasium international gymnasium. Mo say eh?
Oh, in my say.
Okay, let's move on.
Sure. I think, you know that public health's been doing a great job here. And most of the response right now has been public health's responsibility. The hospital has been busy with the regular care, giving regular care, and the community has been great about getting their vaccine, but otherwise medically has not been too effective. But now Omicron's here, and the best way to respond to the spreading virus is not just with public health, but the hospital, of course, has to get ready. And believe me, they're getting ready. We had a long meeting with them today. Those doctors are so determined. They've already started making changes. They're getting ready for if there are patients who need their care. And then the community must put some work on their own shoulders to be able to manage cases that don't need to be in the hospital. That is, there's going to be a lot of children and young adults with a cold and fever or flu-like symptoms. Most of them can stay home. Again, many may not even need a test. You can be pretty sure it's Omicron. And some Tylenol, lots of fluids, some rest, the things that you always do when your children are sick, and then hold them back from playing with other kids for at least 5 days. And that's going to make a big difference. That's the community pitching in. Most parents, of course, when their child has a fever and here it's Omicron, you might be tempted just to run straight to the hospital and be seen right away. But that's actually, the hospital is going to be very busy with patients who are quite sick. So it's important if the case is mild, the child is doing okay, to have on hand some Tylenol to make sure the child keeps their hydration and that they're separated from other kids. And they don't necessarily need to seek health care unless, of course, the fever was not controlled or they started to throw up or get very sick. Then, of course, the hospital is ready to manage someone with a more serious sickness.
Okay, I got a question, Doctor.
Sure.
It's been 2 years, or almost 2 years now, and our frontliners and also the service providers for this COVID-19 are exhausted. They're really exhausted, I really feel sorry for them, but they never give up and keep on working and get complaints from the public everywhere you go. They're criticizing them. They need help. Can you do the same thing you did before, send some of your people down here to help our health workers, please?
Well, first of all, I want to say I couldn't agree with you more. There's amazing heroes here in public health and at the hospital. People are tired. They're just exhausted, and not only have they sacrificed, but their families have sacrificed so much time.
Right.
They work here on Saturday and Sunday.
Right.
The team is here tonight, for example, just like they are most nights.
Right.
A lot of heroes here, sir, in Palau.
Thank you.
That being said, they are sort of, ready. This is this is sort of what they've been preparing for. All the work to prepare for is here. It's time. And they know it's time. Public health knows it's time. So does the hospital. In terms of getting support, that did work really well when we had the federal teams here with us. I think it's the last time that we talked, back in March, and we were able to provide some respite for all the vaccinators there for a short time. Mm-hmm. But requests have gone out, and channels are being worked. All channels are being worked to try to get some additional assistance, both for outpatient and for possibly doing some community testing, as well as in the hospital to help in the ICU and where some of the more critical cases. Again, right now, no cases in the hospital, but we expect that might change fairly soon.
Okay, thank you.
Sure.
Okay, let's continue on.
Okay, there's these changes we talked about for patients. So in the past, when you got COVID, public health remanded you to a government facility, and of course, with as you heard so many patients today, we expect that will double pretty soon. Usually every 4 days or so, 3 or 4 days, or sooner even. That number can go up. There would soon not be enough hotel rooms, I think, in all of Palau, and so every community in the country has moved to a different chapter, where the community begins to learn about COVID, when they need to seek help, when they can stay home, and the isolation and the quarantine are done by the community and not necessarily by the government. And so we're at that point now. But the community needs to know what to do, of course. And public health here has created a fantastic form. It's adapted for anyone who has COVID. If anyone is diagnosed with COVID, these forms are given to the family, how to isolate a patient at home, how to quarantine, what to do for each individual to keep them comfortable. I can tell you that for patients who are in isolation, it's important that they stay in their homes. These are the people that have been diagnosed with COVID-19, so it's important that they should stay in their homes. They, of all people, they must really wear their masks at all times when they're at home. That's not always comfortable to wear your mask. We understand that, and we're trying to get away from the cloth mask. We're trying to use surgical masks, and so public health has already stepped up and created a fantastic home packet that has the instructions in it. It has surgical masks. It's got Tylenol in it. It's got hand sanitizer in it. So it's very well designed for a family that has someone ill at home.
I see. Okay.
Those folks that are in isolation have to monitor themselves for symptoms for runny nose, sore throats, scratchy throats, headaches, and fatigue. Some of the old symptoms you heard about, like loss of taste or loss of smell, little less common with Omicron, and it more seems to be scratchy throat, headache, and fever, and tiredness. And then there's a number here provided if that person starts to feel more sick, because they may come in for another assessment. What's really nice here is that Palau is going to be able to have treatment that is outside the hospital for their COVID-19. So we can talk about that. Most patients, most individuals who get COVID-19, they're going to be fine. They don't need treatment. They need Tylenol. They need to be isolated and at home, and they're going to get better in usually just 2 or 3 days.
I see. Okay.
Some of them are going to be very sick and will need to go to the hospital right away.
Yeah.
And public health will be there to monitor those at the time of diagnosis. We're implementing some changes for that even today.
That's right.
And then there's other patients who can go home. Maybe they're a little older. Maybe they have some diabetes or obesity. And if they have some symptoms of COVID, and they have some risk factors for getting sick, then there's actually some medicines they can take that will prevent them from needing the hospital. And most of those medicines are not here now, but they are on their way. We know they've been ordered and they've been shipped. So over 150 courses of these medicines are coming to Palau, and there'll be more after that. And that's, again, for people who have COVID and they're uncomfortable, they've got risk factors, and they have some symptoms of disease.
Yeah.
And we're setting up a new clinic for that, and they can come and get their treatment in that clinic, and then after that treatment, they can go back home, which is marvelous for.
So maybe you can explain, like, we've said that we have region cove, and the reason why we have an ample supply, like over 300, but
yeah.
Maybe you can explain why.
So one of those medicines is called Regencove. Works fantastic. Great medicine. We've given a lot of it in Saipan. We've given a lot of it in Guam, but it doesn't work for Omicron. It works for Delta. Because Omicron has shifted and changed its spike protein, we say, that medicine doesn't work anymore. Which is why the medicine that you need isn't here yet, because it's new, but it's made, it's been allocated for Palau, and it's on its way to Palau. And so it's sort of a Regencove, but it's tuned and works better for Omicron. Quite effective, 70 or 80% protective of having to be in the hospital. In addition, people might know, and they may have read, the FDA recently approved some new pills to take. And this is a 3-day course of medication to take, and 4-day, I believe. And these medications are also arriving on island, and we're setting up the clinic to be able to hand those out to people. Again, this is not for everybody. If you're not having any symptoms, this medicine's not for you. You don't need it. If you don't have any risk factors, you also don't need this medicine. We're saving this one for people who have maybe over the age of 40, maybe diabetes and obesity, other health risk factors. There's a list of those. And then symptoms of COVID. So we're worried that this person might have to go to the hospital soon. But and so if we give them this medicine, they can go back home, which is wonderful. Once they get to the hospital, there is treatment that's typically needed, and that treatment is already here in Palau and in adequate supply. We're trying to get additional doses of one of the drugs called remdesivir, but oxygen's one of those medicines, and you have plenty of oxygen. Dexamethasone is the other one, and I know that your team has done a great job of making sure there's lots of that. So I think, again, Palau's ready. They're as ready as they can be, more ready than most communities when COVID comes. And that's because of all the great preparation work that's been done in public health for over those last couple of years.
Okay, so can we say that preventive measures is the key to manage or reduce the spread of COVID-19 virus? Can we say that?
Oh yes, of course. The preventive measures are needed to protect the hospital, to reduce the number of patients who get COVID who need to come to the hospital. Especially for those who might be high risk, could really save a life by wearing your mask and making sure that you are keeping a distance. Those preventive measures about not going to work or joining groups if you feel sick. To be honest with yourself, and even though it looks like fun, everyone's having a good time. If you're feeling ill, you need to stay home for 5 days.
Okay.
And let this pass. You're doing the whole community a great service when you can do that.
Okay. Okay, let's continue on. I hear somebody coughing. Check her out. Maybe.
Ya tulik, jangan ngaran jangan solo wear a mask. Ika kama dia wear give you masker elang mang. Kan ko mo magalmol mo rokola tong makararay kal mask mai ken mo mo doklo. Pwede. Elang ang pal require the role other mer hospital. Of course ang gira the mask and specifically sa over hospital imla mo gira the mask mang.
Hindi agi mesa kami mo te kama matagi mo tangay.
Tuloy ang mahali ako tunga all ko yung ulan sa atol menggorangan niya message ringin.
Okay. Anyway, our telephone number here, callback number is 488-4848. So if you have any questions to Dr. Rostrom or any members of the EOC, please call 488-4848. Okay, now back to you, Riter.
Kamal masaulit tulik. Hindi sa mamalamaklat kay kel bladung kadruba kalobangget.
Okay.
Mula sa kloluryo ramla makatmokla agi malmla nga kadamla kay nga sir adolong level law ay sra rogul adol maseng ngarang ay gel sab edel mga tmokle kadol ka kristian rakt may mal kloluryo al kit makler adara ministry ra helda prepare tel hospital regit mang sa el sugo mang mornia ser tegi del COVID-19 en sabi el mail me malaya yel lugurul el mortrigel el hito ya rapid ra COVID-19 so waitel lugurul ng karuba kak masay ay tegi del Omicron matel COVID betok rigida adi mild symptoms rigid sab edalo malimar watay lenor malima clodral engol nga sa rigid rablit awul magi mlamo olingitra adrablu selamel positive malubeng ko nga symptoms satir gimal mga leestik mase please mga sugumame bora kablimiw moru lay gay del teleta el niya ol nga sergumi mo ko mongil da kam privital raktal mora arbotokal at lesel bol botokal atal smer eng morni trigel me botokal mer hospital en ilmos mer nurs maluba resources amok ngemet masel labor ni trigel maralo spel met mul mer hospital en way ablabol compromise ta a system regid awul magimal lolingit tuli gal morar adak mase plisable moklorngud da kay nga sera dolongolet mal suguma adra public health da ulingit terkak mase kautel ka gimla matigar kawel pasatibra covid ma igagida sab emel rumul rablim igagida gen mal girem momrul mal ubeng tamatigar kak mase kamlok medra adel covid mangirem el quarantine rablim igagida gen mal girem lol tirakle tulik mal sugo mandi ungile haledik ko over igagida mal di makasayel mase ngarang agel girem el mru lesel obom ray
Selba, suma capacity be morme, ebes que vama 1, 2, 3 rogula sel gote que magara onge de, apa.
Amai say. So sel ngia mal clo tu telela mal girem el dinga rablim. Mal da se emel motob de girem el dio maskara vekel time.
Ya, mem statel wase. Al suguma hospital am tigra al positive. Kaul adel mem laer nga al hospital make sure ko ba masker kau, mga ka wera bok masaram la aklo ya masker nga al positive bok masaram la do bangel ngal adel mem laer kau, en girem teru lo mask sen wase.
Mal maranya tuli kamral masaul. Mal ube kamler hospital ko koram lo mal asirgal gora mukol umur gole makaw takyal el hospital ni bil striya rogul adal ngar el sel mlay mal giri lo mas ke gida gora tel gi belonga tamador git mungi layol te circulator al sel
okay mangal magigad umur gole malu ben gora mukol umur gole la mal giri lo mas kemen dia spray det
mangel adalo makal ringi tel teru mal teo ngal ngaramlay agiri lo mas ko rogui
okay.
Okay. Ati tay mada kal si ela da kalomas ka toloy malubeng gel gerel ngal kal da kal sab el dingil gut mal mere ramas karingi.
Okay.
Pero kula da giri lomas ka. So se girel mal mobla katakla.
Well taken.
Oy say mal gira del sel da ngarablay gida bl oil so adal makalom mur so ay gida gel momade el gel bl oil bl gar del ngarablay magara blit ay gira del mongul moda dorul ele tiang ada kal forever tiang ada yakade time sa idul goring gal toktang al masing 5 to 10 days and then ang most of edel guk mamrula igel dorul. So el Alzheimer hospital saying 10 days.
Okay,
isolation.
mabibira tugol partra khat surigita tugol omla me kay ungita ma ale misosia amle me ngumsange agida gire del mosto mo say.
Why say? Ita kata kay buged. So as much as possible ang gira la angel smer el guk marnya ba sure ngi lami iwai werngi.
Okay.
Al sugo mangarnya guk bathroom mangya mangira el guk marnya bathroom werngi. Dil sugo mandia ka gel sis aklar adres masay sel labora bathroom ngirel momre ke ngarnya disinfection mga clear bathroom ending mal girel dingara room ringi.
I see.
Adira kal del gimol si sakrar ada kasi ngungila blay al open mang ayol sa metmu emotbo bata. So al sugo mga al sela room al air condition ngungil al sel gibel open ramador ngi masay yagal yol sel nga al sel ta room asa el tob al sel da kadil ngar al sel.
Okay, ela tiagi da next question. At sugum mnamomre ka 4-5 days nga ham mo feel better. Tanggal me certifier nga kan wase ak mlamo ungil man sa bekel toba ng hospital amirabli kan ube nga utangan mo hospital mo por test nga.
Tulig ela sel mirada yo ay sestir mula say kamla matang ma 5 kamel me test.
Oh, makiko.
Malinda ka mo bes sel o motakyal el mil me test mangirir adalo mas ke open amado. Ding lang arnya time riter sel angar mata del time en mode ka way ke gidye. Marara gimo o way trar adik masay mla mode ka test regid and digya the test. Kada di mo madengel masay sel bornya symptom sergaw el gora ongar ngit ka makaranya e kalo asme ang kay ng karubal masay kalo asme el tel omicron. Sense edel mulay serite.
Why sa tulig mong tamalakol waseng 10 days through sel gira mal isolate sergaw. And mengkel smer mengira 10 days el lugar sa sel mal atente yung kadal amo test al sumangarnya test kadal test elang yung tulig ang mlamo tirgale ada surveillance sa umkodong or tirgale namadang almod adu or tira interview identify contacts ending quite tagi del ngal sang sela test mlamo dia kada test contacts.
Okay.
Sige al ukol made al self al ngarinya test sige del walong ay maklamsay at tirgale del contacts and sabari del me test. Ma at ko ya mor tirgale abel waseng tamorger ra o ngarang me musay del test either of the test out waseng ngara quarantine mo sa hidal time test o correctira quarantine ringi.
Okay, so mga nya adam lekker o ayablike emergo emle positive mon mo 10 days later mo cell pasyo man open pial blind remain contaminated until when and comes so they say.
So the question, Dr. B, is if he has a tenant and he was a positive and he lived in a unit and then after 10 days, so how long after that 10th day is it still considered contaminated? Does it need disinfecting?
The unit itself?
The unit, the house, the room.
You know the patient's good.
Yeah, after 10 days.
Yeah, you know the science for that doesn't exist. I don't think anyone has tested that for the bed sheets and for the trash and for those things. So I think we would just recommend the typical common sense approach of washing sheets and regular with water with bleach in it in a regular load. It could even be mixed with other sheets. That's okay, especially after 10 days. There's been no report of virus surviving beyond that point on common household surfaces that we know of. So you should feel free to, for example, there wouldn't have to be a sterilization of the carpets or just a wipe down of the counters and washing the sheets and the normal things that you would do between tenants should suffice.
Okay. Riter ngong balwala mo la sengire the disinfected kalblay sola enyam uspel safe enough for mora nect la ulak malwa ki on ay gagi dele hotel motel type rental units and there's a possibility that some people come here positive and they leave and they go back to somewhere but that room that was used by a person that is was a positive remain contaminated until we disinfect that unit or it takes maybe 2-3 weeks to get rid of it completely.
Yeah, waysek lang hotel. 24 hours airing out and cleaning. Oo, smell kay
Oh, okay.
Selling, it should be good.
Monday. Yeah, mangalada kasi ngukte kalkora special sterilization process sa awam go through ni sel omoru ringi rabe kal time sel bol mere ka tenan kal kirablay e kamol kut makli e wipe down ringi e smil kay kal sit sa mga curtain sa mga rang say dia enough. Di of course e kal mo clean ringi the person cleaning should take precautions and wear their gloves, their masks and stuff like that.
Like if 3-4 days or 5 days and they have some LDG back to normal.
He's asking, can they leave it 4 to 5 days and kind of feel safe that all the viruses are dead by then?
Yeah.
After the 10 days?
Oh.
After the 10 days, then wait 4 to 5 days just to make sure, or no need?
I think no need.
No need. See, okay. That's good. So we don't have to clean it. It'll automatically, disinfect itself.
Well, you have to clean it for your next tenant, but please, you don't have to be too paranoid about it. You can go in and clean it.
I'm trying to do away with cleaning, and then you guys said you will go and clean it to be safe. Okay, I understand.
Tulik mga hindi kaya kita ko ramal soma lumaktat karar adaling ngarinyar adal ko kamay masengkal sa ang atyo mibay senga quarantine magimal lolingi trar adal masel suko maka-isolate maluga ka quarantine rablay please edi mga rablay mo taka ngaling maldi 10 days and then ang sabi malguk mo umibay.
But the general public have to take some sort of responsibility to practice those preventive measures by, for example, I went to a restaurant and couples came in with the wristband, blue and red, I think it was, and then I saw him coming into the door. As I was going into the restaurant, then I saw him and I said, hey, let's get the hell out of here. So we left, So I think what I'm trying to say is that, also us, the regular people, we have to take some kind of preventive measures by avoiding contact or near to these people that wearing the wristband. I think that we should do that also. What do you think? I recuse myself to go into a restaurant where I can sit next to.
Hindi amat niel yung mga kumbara restaurant da tukara da ngi mesa adalo wristband da queen
Nice.
Kumbara ngi yung algiril sila sa baril mo regel pandemic certified giz il mo regel del basyo.
But they do it anyway. They do it.
Well, tamang and then kita kasi di sumong baser please edil order at take out the tire to pick up pakali lorail la kalabong la kier selo mur mandira kal diungi la sumong komong emestri rendira kal diungi la omkol el mail wase sira adar ngara ROM nga stel basyon mal meserta.
They shouldn't be in a very crowded area.
Okay, and I got a question just came in. It says please ask how can I distance with my family of 5 in a 2-bedroom home? What is the best way to keep my distance away from them?
Well, if no one is sick, then there's no need to distance.
Okay.
Okay, so that's the first thing. We don't want people to distance from their family.
Okay.
Right now.
Okay.
But if someone gets sick, then it's best to sort of assign one of the 2 bedrooms for that sick person.
Mm-hmm.
Other people may be sleeping on the couch or sleeping together in the other room.
Yeah.
And the public health does have some recommendations for how to do that. I think you went over those already.
Okay.
How to isolate at home, it does mean some inconvenience. But one of the things that's really important to remember about Omicron, it's so infectious.
Okay.
It's so hard to stop.
All right.
But it does go away compared to Delta pretty quickly. So we're expecting a lot more cases in Palau.
Okay.
But we also expect that it could last only maybe a couple of months. So it might go on longer than that. It could even be shorter than that. But in general, Omicron is a variant that passes pretty quickly through the community. So infectious, it's it's already, as we've seen the numbers here at Public Health, which started at 8 or 10 and now at 20 and then up to 50, and I think they're going to continue to climb higher yet. I don't think we're anywhere near the peak.
Okay. Here's another question, which I think kind of technical question, but go ahead and ask it. Ask the question, and if you can answer it, fine, but if not, that's okay. The question is, if I have to isolate for 10 days, do I need to apply for sick leave from work? I don't know. Written civil apply siguro na supplementary lang kurang ada symptoms sergao at 10 days mga isolation and so we'll put in for sick leave sa kita question.
Asum sick leave ka sum ka mo identified positive and then automatically more sick leave.
Hindi ka automatically discuss sick leave. You apply for it. Apply for it. They don't automatically give you sick leave. You have to apply for it.
Oh, mo saying sa emal nga pabil nga tokta ang maskal wa sa kangara sick leave 10 days. 1 day.
Okay. And if I don't have sick leave time, then it'll be charged to me in advance or something like that.
Sila kita ko taksal madangali at tuli ka.
Okay.
Ako kikira kabalment ako tingala sa kabalment at kung ang ka sick leave ra ka sa ila maledra ka request sa advance sick leave ra ka.
Okay, that's the answer.
Sa din taksal madangali ko private ay ko kira lay ko bali mo.
Oo.
Ay ako kurang alya policy kira di kabalment ako tangali process ring.
Okay.
Hindi, sir, ako tulule la pandemic, ya kadamle mitrar at olingi tertir mase bakay nga sir role la ungil el sick leave policy marada la kalbo lomar tertir belo bior el smer el YC so ay gigit ko private sector ako tolingi tek mase please mo lang sewe helprar at malakal salmo obul. Tuli ka before at continuing please haledik ko over igal ko di mal di makasay lemle nakal ruba ka dim lakal sal insera question rengel ngara 2 bedroom. So you know I gimal malgo at sel me gik masay ay gel rogul du rule so moda kal it makalomur ela ka mamal adal ngara EOC ata ka gimda kalomur sel gimo meeting amas ka roguy sel gimo mura gi gora oprid so moda gim ka story gimo murle Sige dati la virus sa limul. So moda kaway gayi das makalome sa TV. So ang karuba kamlo mention ok masel su man 2 bedroom maybe si al assigner sige del one room el mobility ars mer. So sige dele even at maskid advice ok masel su ko manghal maagiri lu ngarawan el space yawan na ngarapital side ra room yawan na ngarapital side ra room. So sige dai lulukok masay kada mo ko ra mata arbasude mo inconvenient ending mal gira dal kay ngasera dalong le dara tulungal ka matel talbalwa de tuli ka mang le agi mo al ngasera bulul mo skura babel sa baam ding mo ngosong cycle facilities mang gira dal mo lingitrar adal isolate malubet ta quarantine rabliri so ang mal sige da mal important as much as possible as mera ngarabita ra kung space rablay ma adal ko yang ngarabita so yegi da kadokora mo o ora awara mending ang kay kita karubak pasen tiang adi mere edda kalsal gupmal mo makate kat do arme engi ay new.
Okay, thank you kaman la detail ngi kamla smoothing man mora detail man ki la mo understand gusto lang edol okay ka kon
ngadi mlegay kita tulik elang ya kadam digal wasang ari sa idal hotline 4880555 se seldo ko larinya call time ra total mga ra 3 matal klora club say 11 o'clock elang ya kimla sir apra ko hotline ra medical hotline book sumar ada ko ra asmer ngariya ko ra questionnaire tira lubit kay gider ko ra amlamdang asmer ko ra ngariya kariral mura atokta malubeng nur say gider dengwa ko sa most of the ko laring wal kwadir ka kim sa amal announce ni elang tadir kamurura schedule tiras toktangal mo enseringi usay dia aklugo ke self al amrula schedule waseng tuatanga mo ensera dengwa and then I got the announcement del morablu.
Okay, meron ko question Ali caller.
Ay balwin ko siya tulik. Balwin ko siya lewat kilala na iosim kilala toktak.
Oy.
Ila pro sigal ila istiday kaladet ta luwag gali mo. Kasi kapabalo sa sel kipara Aja jiwa babura jiwa free baru aja berapa.
Why say?
Akan elak charges. Elak semua rules. Abi obat respect. Sel 3 feet baru 6 feet.
Right.
Distancing.
Right.
Elak berapa rules abel hesel sekal spell.
Mabio, kom di umaskar terung yang iya take care kau. Kabong Edward mo ka message si.
Hindi ka mal lamongil smoothie at tulik. Hindi ka ngot esekat mo.
Kom di umaskar, baby that time Edward mang aigal, kau sudah kamen sensor git. Asub dia betul sa gesper, dunia semlia maskar kau, nur serawer pemerut terang. Kalau ia maskar kau, bukom di lo maskar niya take care kau. Betul tu. Okay, tengo aquí que tengo una colia tal sigang dir ngania somil dormon nga atama temi we dol mesel somil
tuling hale tegi da gora report taldi gamne soy som hale ba o ay to kutbedi man
lemay
o el alfil se gomne la sengari se gidele open padra omrusra favara kril mor babra fighter لسه قال سيد الستيغا كده ندير لو بريق المروس لو 200 دوري 5 are more نالغ 5 to 11 are clear المروس الغط الوروس so unfortunately I get روغو الوروس را 5 to 11 years old الدولاب ملاريا يجي الدريان من دوري 1 ملاريا 200 المي من ملامودياك يقضى expect الموتل 200 لنقول سيجيد يا تلغاي بس كذا ألغاي بس كذا أدرى CDC سيد أوردر فاكسين.
أوكي.
أي الموتل مو بليس را أوردر إبو بلاس من سبعة من مسام من نوع كلور سي.
أوكي.
نقول غرام لميو دا جايجيد لوبروس را نقول غما جي غرام ل ديملاجي موليتا راكلول الديسل أوروس دي تجيد غدنا وبيل واسطة بتوع أرغسي أرغال ngarse gid el age group el 5 to 11 lo sper orus man agi mo malas mal order ra abato mo sab el me bato man digo to dir el ang wasea sel lo mrusra Wednesday ra 5 ra 3 mo 6 adi mo omrus el morar 12 ra kril morbab
okay
entonces se 12 ra kril morbab tin saber la first dose en la plol adal me wa first dose ni
I see
seguid el Wednesday ya omrus aklugu or seguid el Puka Moderna booster 3 o'clock almost 6 o'clock.
I see.
Ito lang. Dr. V, did you want to add something?
I have a question for Dr. Brostrom.
Well, first, I just wanted to add to the vaccine discussion, and maybe you mentioned this. I apologize. And that is just a recommendation again to the listeners. One of the most important things you can do to protect yourself at this point, if you haven't gotten a booster, to get that third shot. So I know that Public Health will be at the pod tomorrow at 3 o'clock till 6 o'clock just for boosters, and the same on Thursday. And if things are busy and we need to open up some more, then we're going to add additional booster clinics. There are several thousand people, adults, who did a great job to get their vaccine, but they still need their booster. Unfortunately. So if you got your shots done and it was before September, before 5 months ago, then this is a great chance to really protect yourself. When you get that booster, it really protects you from the Omicron. So recommendation again for adults, actually anyone over 12.
So we're not doing booster for Pfizer yet. We're just doing boosters for Moderna. And it's anyone who got their second dose February, March, April, May, and June. So starting tomorrow at 3 o'clock to 6 o'clock, anybody can come in for their boosters.
There you go. Thank you for getting the rest of that correct.
And then also Klugu kal Tuesday mo start el tirgal nurse homebound mo start el marusa booster dose el more tirgal homebound mang di kora di kutabdi o ay el more tirgal homebound el wasay tirgal nurse kami wam la start el modong lekong schedule kami wal mo ko marusa kami mang mo takale toko down the list o ko start akadela sa klugo kita schedule dal momrusra R8 del homebound.
Okay.
Hindi mo lakpo ngerite. Tuli kang nganya blow oil alcohol may blow da ka enser ka ma'am. Lo gerek masay ngoy ngarang agi ungilal kim kol malubay gimo me sa toktang kol ase arangal ka kalsak lang ngungilak por ER. So elang beto ka to kada mo malukora adak masyo ko morbay suko marangal giwang makayal da makamiya makayal de kora makayakara ang sabihin malatay lenore mali marakloral di nga get tuli ka blol dio paranoid blol dia kutek masemo makarang mo self mal momring laptru ka call al ube ngoy ngaral time ang namo gire kalom ko tong ratokang malubak mo mesa toktang so mo askara Dr. Brostrom to explain when if somebody is isolating or quarantining at home and has symptoms, when would be the time to call for medical advice or to seek medical help?
Okay.
Yeah, sure. Thanks for the question. I think it's really important now too because people with COVID are going to be, most of them are going to be managed at home with the kits that you're giving, with Tylenol, with plenty of fluids, and they're going to be fine after just a couple of days. But some people will need to be reevaluated by a doctor, and that might just be because of a fever that's not going down, changes in a person's ability to think or to make sense to you if you're worried about an elderly person who seems confused. But usually the symptom that brings people to the hospital has to do with their lungs, because COVID affects the lungs, and that would be shortness of breath. So a person who's breathing rapidly would be someone where you want to, if you find they're breathing fast, they're going to need an assessment by a clinician, and they'll do a careful examination and determine whether that person needs to come to the hospital. Or there are other ways to look at the breathing. For some people, they're just going to all of a sudden not be able to go up the stairs. So they'll feel short of breath trying to go upstairs or speak a full sentence without having to pause and catch their air. These are the symptoms of someone who's pulmonary-wise, lung-wise, starting to have trouble. And there won't be a lot of these patients, but these are the ones that need our medications. Doctors are ready for this, and this is when you'd want to make sure you call that phone number.
Right. So, in other words, if someone is coughing and never stop, or have a headache, or cannot talk anymore, major, there's some major things that we have to look at the patient in order for us to decide it's time to go and see the doctor. Actually, mo confused tilang edol mo lasing ngoy nga time sel to consider ngi kita dia ka doktam dia to ngai ngong sel bal blabol wangarang ang gas me regida palmas ten mom sa doktam.
The cough, the runny nose, the fever that gets better with Tylenol, it's probably okay to stay home there. But if the person's having a hard time breathing, then of course it's time to call that number. Some may need to come to the respiratory clinic, the special clinic we're going to set up for the community, or others will go to the hospital and be evaluated at the hospital.
All right. Okay.
Oy mang kami milsadak masel sugumang telguklel dele makukmal di kalbolyo kukmal ndokora di padi makayal kokora moda ka moda ngalaro ko mo confused ka moda ngalaro mo ka musamal basyal alube ka mo kade batlim yeyida yel kora mlamo gire melkolra ER ko ogera toktang sudak mase oy adon morgo moral met mum mlamo gire moral met esakaw to yeyida yel
Di mo ngil aba ma mo itatrile mo no hospital.
Ay se tulik se bebe la kaduk koramal mo klorong udamang bukta mo sal mangilal mo hitoy.
Okay, continue on. Dirganian mo so hiro to.
Hindi ang gora di kay kita tulik ang mga pail nga katiraras.
O tihala ng utya. Ali koler ka bo.
Tulik manuwi ka masngil ko raw.
Oy.
Au mga
EOC.
IOC ma CDC.
Oy.
Eme kung tela ro kung listeners e lo nga sulit tilang at Taiwan ma CDC American.
Oy.
Til al toktangan sen destin men sir gida ro genau.
Oy.
A minister maral.
I see.
Pagmaan nga na akustigal lomrure al time nga niya sir.
Oy.
Ang gilid di mo nga sulit lulu gilid mo diyan mo liula sir mo tir.
Okay.
Pero mo maulili kung man sulang ro ko na ikang.
Okay. Yeah, you guys really we feel for you. We know that you're sick and exhausted, but nothing we can do but to say, please continue on providing service for all of us. Okay, now back to you, Editor.
Lagi tuloy ang kora bigyan mang Dr. B, did you have any final words before we close?
Well, I just wanted to assure your listeners that that additional supplies are on the way, and that the partners in the region are aware that right now Palau is having their first ever COVID vaccine surge, and so we see test kits being shipped to support the surge from YAP, test kits from American Samoa, equipment from Guam and from CNMI. PIHOA has reached out, our neighbor across the region, our partners that are running the healthcare systems are also working hard to get Palau what they need to manage the situation. And in addition, the federal agencies like CDC and ASPR we're hoping to also be able to get some assistance from other federal agencies, possibly even DOD. And in addition to that, there's international assistance coming. I know that Taiwan has promised some testing and maybe bringing some specialists over. So I think Palau by itself is very prepared, but I also think you're going to get good help because we do know that when Guam had their outbreak, Palau stepped up. Palau was able to send them testing. So now it's Palau's turn. So you're not alone. The region is doing their best to support this effort also.
Dr. Brostrom, I'm sorry, but I have a last question just came in, and it's an important question for you to answer. The question is, some of us Palauans are drinking water from water catchment tank. They say we can get this disease from air and all. Is it possible that when you drink water from water tank, getting water from the roof, is it possible to get COVID-19 through that?
Thanks for the questions. It's really important when someone has a question like this to ask someone from the health department, or maybe the answer could be with a reputable online a source like CDC or WHO, and it's important to ask around because there's so much misinformation and so many rumors, especially for this disease. And so as the outbreak occurs here in Palau, we're going to hear more and more misinformation and rumors. And so I think public health knows that part of their job, and then we have an information officer here, part of their job is to get the right information from the right source because that's what the Palau community deserves.
Right.
As far as drinking catchment rainwater, it's fine. There's no reason that you would get COVID from catchment rainwater.
Okay.
I think COVID would certainly be a problem if you were dehydrated. So it's important to drink lots of liquid. It might be it might be a source to if you're sharing a cup of water with someone else who has COVID. That could be a source, although not usually from touch. It's almost always from sharing the air. So no problem with the drinking water, no problem at all.
Okay, Dr. Rostrom, can you advise us that it is the best policy to listen to CDC and WHO and EOC here in Palau and disregard what's on social media, because social media nowadays are really putting out a lot of fake news and confuse us and create more problems. Can you say that?
Yeah, Dr. Facebook is a bad doctor. Palau has some really good doctors.
Okay.
And but some of what you're reading, it's very clever, and some of it's even kind of humorous.
Yeah.
But it can be very dangerous.
Exactly.
And when we try to pass it off as real information, then it can be quite hurtful too. So it's really important. The ministry here has put out some great stuff that's accurate, and of course the WHO and CDC, we're doing our best to keep up with this outbreak, and so everyone gets the information they deserve.
Okay. Thank you so much, Dr. Brostrom, and Irite, thank you, and Edon, thank you, doing a good job, and may God bless you all. Until next time, this is Alfonso DSA. Bye-bye for now.
Bye.
Okay, bye-bye.
Bye.
Won't mess up a